My name is Alexa Shipman and I am the current Editor-in-Chief of Clinical and Experimental Dermatology. The following talk is to give you a few tips on how to get published in our journal. Clinical and Experimental Dermatology is one of 3 journals owned by the British Association of Dermatologists. The BAD is a charity whose various activities promote healthy skin for all. That includes funding research, education and supporting patient groups. Our other sister journals are the British Journal of Dermatology and Skin Health and Disease. Clinical and Experimental Dermatology separates itself from the other 2 journals by being a journal primarily for the education of fellow dermatologists, nurses, etc. We therefore like to see papers that have an educational bent or that lend themselves to continuing professional development or CME points. Case reports are accepted, particularly if they're classic and well illustrated or novel, but educational is always key. We like up-to-date reviews on topics, particularly if they've not already been done to death by other papers and journals. And if they can cover part of the dermatology curriculum, they are most welcome. As well as helping trainee dermatologists, we also like to help the generalist jobbing dermatologists, particularly if they're not able to get to meetings. Essentially, I'm looking for papers that people will want to read that either educate, instruct, or remind them about important things. Whilst we're always interested in papers that might be cited, impact factor is not our primary goal at CED. And I'm happy to have papers that are of international or general import as well as specific. New things are always interesting, but it may not be a new disease or a new phenomenon. Rather, an up-to-date review on an old topic is always welcome. I'm always interested in papers that would change our normal practice, including negative studies which should suggest that we stop doing certain things that we do commonly. I would love to receive reviews either on, for example, a particular disease, a test, a treatment. Commonly, we often invite people to write a review from a talk they've already written for a course or conference so that they don't have to duplicate work you've already done. And you can always encourage one of the juniors you have in your team to help you convert a talk into a review. They're very succinct, only 1,200 words, so a sensible use of tables and figures is required to keep within that word limit. And we also ask you to write multiple choice questions at the end to test the reader's knowledge of what they've read. There are 2 articles where I get very few submissions. The patient viewpoint is an article that's primarily written by the patient with very few comments added by the clinician. A patient may have a particular viewpoint they wish other dermatologists were made aware of. It can be used to support a specialist nurse role, for example, or a specialist clinic, to support old or new treatments, whatever is important for the patient to impart to the dermatologists of the world. A noteworthy paper is an opportunity to make dermatologists aware of an article that may be hidden in a different specialism's journal or perhaps a guideline that should alter our management of patients. There's lots of examples of constantly updating guidelines, for example, for the diagnosis of latent TB, the management of long-term prednisolone, etc. And this is the opportunity to make us aware that such things have changed in the general medical world, for example. There are a few things that people commonly do incorrectly, which impedes their chances of getting accepted. Firstly, please ensure that you've addressed your letter to the correct editor of the actual journal you're submitting to, as otherwise it's often quite obvious when you fail to get in elsewhere, when you've not bothered changing either the template of your article or your letter to the editor. Our templates are clearly on our website if you are in any doubt. If you don't have any figures or they're not good enough, I would think twice before trying to submit an article. It's very difficult for us to publish a case report or a histopath case, for example, if the figures are unclear. We ask for multiple choice questions on many papers, and if you've not added them or repeatedly fail to do them correctly when requested, we will reject. We do have a little sympathy for language problems, but most people across the world will have access to English speakers or software which translates, and also Wiley has a translation and paper writing service if required. We're not interested in lots of smaller repetitions of larger studies. And finally, lots of people submit to the wrong article type, and we have clear guidance on our website about where to submit case reports to, etc., so that you get the right format for your article. I can only publish less than 20% of the papers that are sent to us, so I have to reject a great many papers, and I apologise for that. Aiming for an educational bent will help your chances, and if you're in doubt, never hesitate to ask us if submitting to us is a reasonable place to send your article. Finally, submitting papers to any of the 3 BAD journals, the British Journal of Dermatology, Skin Health and Disease, or ourselves, will ultimately support people with dermatological diseases. Any profits made from our journals go straight back to the BAD and our charity work, so therefore please do think of us when you're publishing your work. Thank you.